Post-exposure chemoprophylaxis is any preventive medical treatment started immediately after exposure to a pathogen, in order to prevent infection by the pathogen and the development of disease. In leprosy, the preventive strategy consists of employing medications to prevent the infection by M. leprae in people with a higher risk of exposure to the disease, example those in contact with the patient. Trials with rifampicin used as chemoprophylaxis for contacts of leprosy patients have shown it to be effective. Eligibility criteria for post-exposure chemoprophylaxis, inclusion criteria, 1. A person who has been living, working, having social activities for more than 3 months and 20 hours per week with a newly detected case of leprosy in the last 1 year. 2. Age greater than or equal to 2 years. Exclusion criteria, 1. Pregnant women, PEP can be given after delivery. 2. People receiving rifampicin therapy for any reason in the last 2 years, example for tuberculosis, or people who have possible signs and/or symptoms of TB. Patients having any of the following symptoms should be screened for TB: cough for more than 2 weeks, night sweats, unexplained fever, weight loss. 3. People with a history of liver disorders, ask for jaundice, right-sided abdominal pain and swelling, swelling in legs and ankles, pale-colored stool, or renal disorders, ask for decreased urine output, swelling in legs and ankles, high BP. 4. People who have possible signs and/or symptoms of leprosy. 5. Person with acute febrile illness.
Chemoprophylaxis. Post-exposure prophylaxis with one or more antibiotics given to contacts of an infectious disease case. A single dose of rifampicin is used to reduce the risk of developing leprosy in contacts of leprosy patients, index cases. Contact. Someone who has had prolonged regular or interrupted contact with an index case during the last 1 year. The time period of contact will be 3 months, cumulative, and 20 hours week. Contact category. This is based on physical proximity to the index case. The categories are family contacts, household contacts, neighbor contacts, and social contacts. Family contacts comprise of all family members. However, if a family member has been away due to reasons, example work or education, during the last 1 year, then he will not be included among contacts. Household contacts are people living in the same house as the index case. Contact category. Neighbor contacts would comprise of are all people living in 3 houses on either side and 3 houses across the street from the index case. Social contacts are all people with whom the index case is in contact for more than 20 hours per week for a cumulative of 3 months or more.
Single-dose rifampicin prophylaxis. Post-exposure prophylaxis, in which a single dose of rifampicin, with dosage based on weight, is given to contacts of an index case. In this document, single-dose rifampicin prophylaxis is referred as post-exposure prophylaxis. Greater than 35 kilograms, 600 milligrams, 20 to 35 kilograms, 450 milligrams, less than 20 kilograms, 10 to 15 milligrams for kg weight. Safety adverse event management. The adverse events following administration of single dose of rifampicin rarely occur. However, likely adverse drug reactions are upset stomach, heartburn, nausea, headache, drowsiness, or dizziness, which will be managed as per standard treatment protocols. In addition, the persons may be educated by MPHW during the visit only about that this medication may produce a harmless, reddish coloration of urine, sweat, saliva, or tears. Procedure in the case of an adverse event. In addition to the above-mentioned symptoms, if any adverse drug reaction is noticed by the person, contact himself, herself after administration of rifampicin. The case must report to medical officer of PHC for further management or referral to the nearest hospital. Thank you for watching this videos.